Now, dental cleaning actually doesn't require before 4 months of age, because the deciduous tooth or the milk tooth are definitely going to fall. So I again request and tell all the pet parents, please do not use human toothpaste or human dantamanjan to do that. Feeding of rawhide bones is a very good method of keeping the teeth clean.
Sir, talking about understanding the dental requirements of your pet, ऐसे कौन से हमने साइंस हम आइडेंटिफाई कर सकते हैं जिससे हमें पता चल सकता है कि हमारे पेट को डेंटल प्रॉब्लम्स हो रहे हैं?
Okay. सबसे इम्पोर्टेंट बात है, एज सबको पता है, मुंह से गंदगी आना, बास आना, इवन गैसेस पास्ट, improper eating habits. सबसे most important, just lift up the gums and you see a different color of the tooth. That's more than enough. You might have to, the veterinarian, once you ask the veterinarian to do a thorough checkup, he himself will be able to tell you how bad the teeth is. But उसलिए भी आपको veterinarian को examination के लेके जाना पड़ेगा, fearing that वो dental बताएगा, and if you मतलब उससे आप पीछे हट जाओगे तो नुकसान करेगा. So better है कि you need to actually regularly get the teeth checked up, and it's just a 2-minute job for the veterinarian to make out how bad the teeth are. One more thing is that the back molars, because it's a normal thing for them to get discolored. Lot of people have that thing ki why the other part of the tooth or the other tooth are normal colored, only the back tooth are this thing. Is because of the maximum salivary secretions are from that area or that tooth. Because the salivary gland secretions are from that tooth. And imagine the patients who are carnivores in nature. They require to chew on hard bones. They eat a lot of flesh. They eat a lot of bones and everything. They have to chew on dirty things like meat and all, which is like a very thick layered. So the salivary secretions are quite different, unlike in human beings. So definitely there is a staining, because the staining itself is a first sign where it requires a cleaning. So I'm coming back to that, is once you develop that staining on the back part, that is the time where you need to understand that there is it's a first indicator where it could be an issue.
Sir, you spoke about gums. तो आपने बोला कि gums का color से we can determine how bad the condition is. Yeah. So if a particular pet parent, अगर उसको एक basic idea लेना है, तो एक healthy gums के sign में what is the right color that they should see?
See, as gums का color तो सबको पता है, pinkish red होना चाहिए.
Right.
Which is common for, or a normal individual will have it. एक होती है वहाँ पे, अगर आप एक गौर से देखो तो there will be a thin line of red color between the tooth and the gums.
Oh.
Now that is a common of if it's more than 3 mm. Now it's very difficult on a video to ascertain, but if it's thicker, that means there is some inflammation happening below the gums, which is just starting. So that the patient owner has to go and address to immediately. It's a very common problem in cats to have this rather than dogs, because cats undergo gingivitis more common than dogs.
Okay.
So nowadays with the advent of lot of food coming in, pet food, cat food coming in picture, lot of gingivitis cases are coming more in cats rather than dogs. So you need to check that. And bleeding gums as common, like if you give something to eat, or maybe sometimes if you have given him a bone to eat or something and he starts bleeding, unless until it is a bleeding is done by a traumatic injury, it will not bleed in normal cases.
Okay. Sir, as you spoke about bones that help cleanse the teeth, similar to that, are there any specific diets or special diets that pet parents can follow to maintain the dental care?
There's so much specific diets to be specified for dental hygiene. It's that main thing, like how we maintain our own hygiene level of dental. Like if you can wash the or clean the teeth or give him fresh water after, if the pet is on commercial dry food, then he requires a lot of water. Lot of times most of the companies do have a specific coating of its own on the kibble, which prevents the plaque from appearing. But in most of the times we are not into dog food only, we are giving home food also. So a lot of times people do give vegetables, or I've seen a lot of times green vegetables are also given, which goes and stuck up in the ear cavities or the teeth cavities, and then they create a little bit plaque later on. So keep on observing. There is no specific diet for that. There is no hygiene diets. And also most important thing, like the next question probably would be which breeds are having dental hygiene. ये जो छोटी breeds होती हैं, जो lap dogs or pocket dogs, they have more issues because of the type of dentation. I'm not meaning कि उनके दांत अलग होते हैं और दूसरी ब्रीड के दांत अलग होते हैं. ये है कि उनके छोटे मुंह होते हैं. प्रैक्टिसेबल है, जैसे पग्स है, शिट्जू है, पेकिंजिस है, यॉर्कशायर टेरियर है. इनको इश्यू ज्यादा आते हैं, प्लस उनके ओनर्स भी उनको पैम्परिंग ज्यादा करते हैं कि ये खाओ वो खाओ. दे ईट टेबल स्क्रैप्स. और टेबल स्क्रैप्स आर बैड. मतलब गंदगी वहां से शुरू होती है. हमने कुछ खा लिया, वेफर दे दिया, बच्चे को दे दिया, बिस्किट खा रहे, मारी बिस्किट दे दिया. ये सब आज कुछ नहीं नुकसान करता, 4 साल या 5 साल के बाद नुकसान करेगा. तो डोंट टेक दैट ब्लेम कि हमने दिया है उसको. वो तो बोलेंगे यार हो गया, बीमार है तो दांत खराब हो गए, उम्र की वजह से खराब हो गए. इट्स नॉट लाइक दैट. हाउ यू मेंटेन इन द इनिशियल ईयर, दैट आल्सो. तो स्मॉल ब्रीड्स, पग्स हैं या ब्रैकियोसेफेलिक ब्रीड्स है, बॉक्सर्स, इनको डेंटल इश्यूज थोड़े ज्यादा आते हैं बिकॉज ऑफ द टिपिकल डेंटेशन.
गॉट इट. सर मेरा अगला सवाल इसी से जुड़ा है कि dental health जो है, so how does it impact the overall health of a particular pet?
Okay. Now this is a very perfect question for this thing, is because काफी टाइम ऐसा होता है कि people ignore the dental health and they land up into some major issues like kidney issues. Mostly kidney issues are connected to liver issues, specifically in cats. What happens is when the patient comes to us with a dental issue, we tell them we have to do a blood test to know if the patient is physically fine, to know it can go under anesthesia. Now, most of the times or sometimes we find that the patient has got a high creatinine level or high kidney levels. Now, this is always a debate or a fight or a problem for a veterinarian to convince that this can be result of the periodontal disease, that the kidney are having an issue. But owners, to convince them that the patient is looking fine, is eating fine, how do we convince them? So if you maintain the dental issues or hygiene from the day one, chances of them having these issues are less. So in cats, it's a very common problem that whether the dental issue is causing the renal problem or kidney problems, or the kidney issue is causing the renal problems. So I personally feel that they are going together. So we need to address them as early as possible. Lot of times we see if the patient is physically fine, we take that initiative to do the dental cleaning, and actually it makes a lot of difference to the patients because he starts eating properly, and that's why they have a proper nutrition, and nutrition also helps them to build up their immunity to fight disease.
सर, पेट पेरेंट्स जो जिनको आदत है उनका डेंटल क्लीनिंग की जो जिनको आदत है, दैट इज फाइन, बट is it safe for new pet parents to perform dental clinics, or should it be handed over to a professional?
See, जैसे मैंने आपको बताया कि अगर नॉर्मल आप टूथब्रश से करते हो जो स्पेसिफिक पेट्स के मिलते हैं, तो उसमें तो कोई इशू नहीं है, वो तो आपको सीखना ही पड़ेगा, और इट इज बेटर फॉर द पेट ओनर टू डू इट. पेट पेरेंट को ये सीखना बेटर रहेगा. आप उससे डरोगे कि वो काट लेगा या कुछ करेगा, तो वो नहीं होना है. ओके, आप वो बढ़ावा दे रहे हो डिजीज को. यू आर टेलिंग द पेशेंट टू गो इन फॉर दैट डिजीज. एंड स्पेसिफिकली क्लीनिंग, तो आई डेफिनेटली द वेटरिनरियन हैज टू डू इट बिकॉज इट हैज टू बी डन अंडर प्रॉपर मेडिकल सुपरविजन विद anesthesia, and also sometimes x-rays are required to know if there is any root infections, so then we can remove that particular tooth also as and when required, so that we don't allow the patient to go into too many of anesthesias and too many painful procedures like this one.
Sir, can positive reinforcement be used on pets to encourage them to chew on some healthy dental products?
Well, see, I'm not saying no for that. The funda comes is, or the problem comes is, all these dental chewies and aids and so-called whatever are have to be palatable to that particular pet. Lot of times we introduce certain products thinking that's the best in the market, and particular individual pet may not like it. So you can't force a pet to have that dental hygiene products and all. Lot of times company claims versus the practical claims are also to be ascertained whether there is actually a requirement for the patient to have this product, or whether if he's having that product, whether the results are going to be there by having the product. So that particular question में यही है कि आप जबरदस्ती तो कर सकते हो, लेकिन ये है कि कौन सी प्रोडक्ट को कौन सा पेशेंट को चाहिए वो इम्पोर्टेंट होगा. तो वेटनरियन आपको बताएगा कि हाँ ये पर्टिकुलर प्रोडक्ट ये लेवल पे है, इसका डेंटल इश्यूज ये लेवल पे है, आप ये लेवल पे ये करके ठीक हो सकता है, ये पर्टिकुलर दवाइयाँ कीजिए. या नाउअडेज पेस्ट आते हैं, जैसे मैंने आपको बताया था पहले भी कि लिक्विड्स आते हैं जो आपने पानी में डाल दिया तो पी लेगा, तो उससे भी क्लियरेंस मिलता है.
So now moving on to the final and a little scary part of the conversation कि सबसे common dental procedures क्या-क्या होते हैं, और वो उनका रीजन तो हमने जान लिया, लेकिन उनको प्रिवेंट करने के लिए हमें क्या-क्या करना चाहिए.
See, worst आज की डेट में because India is just developing its dental treatment in India, we are just on that verge of starting a big way for this. So we do attend international seminars and we still know that we are way behind in treating them, is because because of the so-called owner scarcity and the pet owners scarcity of going to the patient through a number of anesthesias. So I do a lot of procedures, but most of the time I have come across where I have to remove all the teeth, bearing a couple of them because they are not bad, but most of the time is because the knowledge of the pet parent has just started beginning in the last 1 year to 2 years about dental hygiene. It's not like that they were not aware of it, but now people are taking it more seriously because doctors are also helping them. There are new products which have come in the market which are helping us to treat them also, and that's why we are also taking that initiative to tell that owners, okay, we need to go for a dental procedure cleaning. Nothing will happen to him. We are assuring them of the best anesthetic procedures available. We also are doing now a lot of things, like when a patient is under neutering or a small surgical procedure which requires anesthesia for 5-10 minutes. At the same time, we are also doing them a dental scaling and this thing which at least will prevent the further damage, so that the owner is also not so scared. I agree. It's like if my own pet will be there, I will also be scared about the anesthesias and everything, because it requires a good deep anesthesia, because you are involving the tooth and the most sensitive part of the body, the tooth and the tongue. So it need to be a proper anesthetic procedure has to be done.
Sir, final question to you. जैसे ह्यूमंस में अभी डेंटल प्रोसीजर्स रहते हैं जहाँ पे हम टूथ भी रिप्लेस कर सकते हैं, so are we going on the track of having the same in the pets as well?
No, sorry sir, right now we are not into that. We are still not doing root canals in India, so forget about the implants. I had in fact a lot of my family friends and college friends who are dentists, and they have told us that whenever you want to do something, we are there to help you. But then same thing comes in picture, that every time you have to anesthetize the patient to do any procedure. In doing implants, you have to see the bone strength. Then we have to see when we are putting the implants whether there is a rejection from the patient's body, because implants are also foreign material to the body. Like humans also, we do a lot of rejections. The same thing can happen. There's a lot of local infection. Plus after that, patient finds it difficult. There's something new in his mouth, so he keeps on trying to take it out, and with force he can take out. Mind you, if someone has got a dog bite, you know how bad it is. So imagine their tongue and this capacity is got, they can dislodge anything. So something stuck up in the mouth, they will not like it. So implants are still a big way for India at least. And abroad also, implants they are not doing so often is because their dental hygiene procedures are much advanced and it's part of their insurance policy. So insurance is also coming up in a big way now in India.
Yes.
So I think in the next couple of years this will happen.
Superb, sir. It was a great conversation, to be very honest, and I really enjoyed the discussion and your answers especially. So thank you so much for your time again, and I hope to see you again on a much better topic as well. So looking forward to seeing you, and thank you so much again for being a part of the show today. I wish you all the best, sir.
Thank you, sir. And all the pet parents, please take care of the dog's dental hygiene. They also are a part of the body. Thank you.
Perfect. Thank you, sir. Thank you so much.